Our journey with meaningful use actually started well before the measures were released. We'd been on a electronic medical record platform for over 15 years. But once we understood what stage 2 had in the offing, we recognized that there were going to be big challenges. I mean, the transition of care measure 2 and the stage 2 summary of care objectives was going to be huge. It was going to be a huge challenge, both technically and from a process perspective. The technical process is we package up a discharge summary electronically. We have to send that in a secure format, which is the direct messaging requirement of the objective. The receiving entity, physician's office, nursing home, rehab center, has the capability, if they have a stage 2 compliant system, to grab that file and pull it in a manner that it's easily readable within their own system. So we had to go out, help them understand direct addressing, and in many cases even set them up with direct addresses, help them talk to some of their system providers about being meaningful use stage 2 ready so that they could ingest the information, and then start the whole process of piloting or testing the sending and receiving of that data.
People actually needed to change what they were doing on a daily basis. We worked out the technical pieces. We could clearly and securely send these messages, but we really had to make sure the content of the messages we were sending to the providers was worthwhile. Was it accurate? Was it the most up to date? Did it meet all the requirements that were necessary? To do that, we actually had to pull people. We actually had to tap into our pharmacy team to make sure that these documents that we're not sending out electronically did not have a complete and accurate med rec on them. So we pulled pharmacists in to help ensure that that was done. We worked with our physicians to make sure that the problem list and the care plans were as accurate and up to date as they could be. You can't have an IT person go out and just tell pharmacists and physicians that they need to start doing 5 additional things. That needs to come from the steering committee and leadership. And it needs to be explained to them in a manner of why we're doing this and the value to the patient.
One of the keys to success was that we had implemented a governance structure to oversee each of the objectives related to meaningful use stage 2. So we had a physician advisory board, we had a revenue cycle group, we had a clinical informatics group that were comprised of leadership and frontline staff members from all those disciplines, working to both understand the impact of the objectives as well as help us solve the problems of the processes that were involved in helping meet the objectives. And all those groups reported up to an executive steering committee comprised of senior leadership, which would report to the board on how we were moving forward with meeting meaningful use stage 2.
To know that you're providing your patient and their provider at the next level of care all the information that's up to date, it's got the med rec, it's got everything that doctor would need to receive that patient safely and understand what happened in the hospital, what that patient's conditions are, what medications they're on, makes us feel good that we've been able to provide that in a timely manner.